assessment at the London Pain Clinic?
In terms of assessment, all of our patients are sent out questionnaires before we see them in the clinic, and we find this very helpful and useful. It can be done online. We have online pain questionnaires. We can email the pain questionnaire to patients, or we can send it to them. They can print it, fill it in. At the end of the day, we just need a reasonable amount of information about the patient's pain. So the sorts of questions that we ask in advance are things like site of the pain, site, character, duration, radiation, aggravating, relieving, associated factors. So within those, we ask specific questions. So site, is it in your lower back? They'll say their lower back, their neck, etc. Character, is it burning, sharp, stabbing, radiating pain, that sort of thing. Duration, how long have they had it, weeks, months, so it started on this date, or I had an accident, or whatever it happens to be. So overall, we're trying to collect as much information as we can. We also ask questions about investigations. Patients may have had MRI scans or nerve conduction studies. What treatments have they had before? What sort of outcome have they had? What sort of medication are they on at the moment? Are they being treated elsewhere? Have they had physical therapy? So that might be physiotherapy, osteopathy, chiropractor. Do they have any, have they had any sort of acupuncture, alternative medicine, that sort of thing. So essentially, we get this information in the pain questionnaire before we see the patient. And personally, I think that's very important, because when we see the patient, we've already got a significant amount of information about them. If they do have clinic letters from other doctors, medical records, anything that's useful, scans, then they can send those to us, they can email them to us, or they can bring those to the appointment. And I find it very useful to have all this information before the appointment, because then, rather than the appointment being asking lots and lots and lots of questions, it means that we can do a targeted examination, and we examine all the patients at the London Pain Clinic, targeting specifically the area which is affected. So we can do a detailed examination, clinical examination, and then most importantly, what the patient's actually there for is what is wrong with me, if they don't know, and the next step is, how can you help me? What treatments are available?
Thank you for watching, and thank you to everyone at the London Pain Clinic. If you would like any further information about what you've seen, or you'd like to make an appointment, please visit the website www.londonpainclinic.com.